As COVID-19 picks up its pace across the metro and new case records are being set in our region, we're faced with the holidays now and how to responsibly celebrate them. We sat down with Dr. Stefanie Shustek, emergency medicine physician at Belton Regional Medical Center, who says now that we are 1 week out from Thanksgiving, it is time to make your plan.
It is absolutely kind of time to make the plan. 1 week out from Thanksgiving, usually big family gatherings, but now is not the time to become less vigilant. You want to think now, what can transmit COVID? And you don't want to relax on the masks and the hand washing. And you don't want to kind of get together with the big family gatherings. I know my family's not going to have their big Thanksgiving dinner, and it's going to hurt this year. But now is not the time to become less vigilant in safety, really.
Instead, now may be the time to get creative.
One of the best ways to do it is something that actually my family did for my 1-year-old son's birthday this summer, and we had it outside. We had kind of a tailgate birthday party and having an outside Thanksgiving dinner, so to speak, without passing dishes, without touching things that other people have touched, kind of have a buffet, use some heaters, maybe a pop-up tent. That's a great way for a low-risk transmission. Another version is kind of what we're doing right here, right now, is Skype or FaceTime with family members that are distant that either would normally be with you or not. That's a no-risk transmission, so that's actually the best way to do that.
But if you are still planning to travel, is it a good idea to fly?
Flying right now can actually be considered somewhat safe. They are still doing the distance seating in the plane. The flight staff is maintaining their own distance from the passengers themselves. Some actual airlines are actually passing out safety kits, which include a cracker, a water, a mask, and a hand sanitizer. They are requiring you to wear masks, and the flights themselves have a HEPA filter within their air filtration system, which eliminates 99.7% of the virus. So it's actually fairly okay to fly. And then you have to think about, well, what happens when I get to my destination? Hotels are still underbooking, so that's very good. Airbnbs can make it even safer. You can rent an Airbnb before your family goes in, maybe spray it down with Lysol or wipe it down with Clorox. And that way it's just you and your immediate family in one place.
The timing couldn't be worse. Dr. Shustek has already seen cases of the flu pop up.
The concern now is that you have the flu, you have COVID, and you still have all the other problems. You still have the heart attacks, the strokes, you still have the immunocompromised, the elderly, the very young. All these things make for a very crowded health system right now, overwhelmed in some parts of the country.
The glimmer of good news, there are promising advances on the horizon, so it's a good time to remind ourselves that this pandemic will not be forever.
There are actually a couple of drug companies now that are touting a vaccine that is about 94% effective. Not ready yet, unfortunately, but will be. But yes, this pandemic will end. And again, I can't stress enough that it will end sooner if people just distance and maintain hand washing and maintain maintain masking.
For more from HCA Midwest Health, go to kctv5.com/HCA Midwest.